Hi there, Nate Rio here from wordofmouthdentalmedia.com. I'm here to talk about something this week that I learned from walking through the floor at the Pacific Dental Conference. I'm actually coming to you today from beautiful downtown Vancouver, British Columbia, up in Canada, again for the Pacific Dental Conference. So today I want to talk about something that I learned from a good friend and dentist, a good friend of mine. His name is Dr. Ray Becker out of Ellicott City, Maryland. And this lesson has to do with two types of technologies that are out there in dentistry. As I was walking the floor in the exhibit hall, you see a lot of different technologies out there, new, shiny, bright objects. And the two types of technology in dentistry can fall into either two categories. The first one is replacement type, and the second one is foundational. Now, the difference in the two types of technology, first looking at the replacement types, most of the technology that you'll see, especially at a big show like the Pacific Dental Conference, for instance, is what I like to call replacement types. So these are technologies that have been in existence in dentistry for a long time, but they're just newer, they're shinier, they're sexier. They replace, they're doing the same thing that you're already doing in your practice. Some examples of that might be a digital X-ray versus a traditional X-ray, or a CIREC, for instance, which is just going to replace lab work, things like that. So the other type of technology is called foundational. So a foundational type of technology would be anything, or it could be a service, would be anything from practice management. It's going to be biometric devices that are going to give you, diagnostic information. For instance, like Velscope or BioResearch products or Myotronics products, things like that. So the main difference now between the replacement types and the foundational types are how they're going to help grow your practice. So if I were to take two dentists and you look at their numbers and they're producing the same each year, and I were to take dentist A and strictly invest in replacement type of technologies, they're not going to do anything any differently, or where it's going to produce more income in their practice. And here's what I mean by that. So if I have dentist A has invested in a CIREC where dentist B doesn't, they're both going to be able to, do the same dentistry. Dentist A might be able to do it a little quicker. There's that, but they're not really able to build off of anything through diagnosis or practice growth. So whereas if dentist B then use some foundational type of products, whether it's better diagnosis or learning how to profit more from those, from their existing patient base, you're going to see more growth there. So, the main thing when looking at the two different types of technologies, your replacement type is going to make your job a little easier. You might be able to mill crowns quicker, or you might be able to get your results of your X-rays quicker, things like that. You may get better imaging, more clear imaging, but you're not going to be able to grow the practice as fastly or as quickly as you would with those foundational type of products. In looking at dentistry compared to the medical model, if you watch a lot of my videos, you'll see me kind of going back and forth, and and that's the main reason where a lot of dentists feel they're not at the same level with medical practitioners is because we're seen as pothole mechanics, right? So with foundational technology, you're going to be able to diagnose more effectively, and you're going to be able to treat a wide scope of dysfunctions and treatments out there, and that's going to allow you to grow a lot faster. So when you're walking through your next big dental meeting, whether it's Hinman meeting or Greater New York or Pacific Dental Conference or Chicago Midwinter, any of those big meetings out there, look at all the technology, and before you make your investment, say, is this going to help me grow, or is this just going to replace something that I'm already familiar with that isn't really going to make me more money? So, I challenge you to do that next time you're at a big meeting. And as always, if you have any questions, give me a holler, or check out our website at womdental.com. That's WOM dental.com for other tips and tricks on how to grow your practice. And other than that, to your dental success, and we'll see you later. Take care.